name is Gina. I'm going to be your nurse today. So we're going to do a full head-to-toe assessment today. It shouldn't take any more than 20 minutes. Is that okay?
Sounds good.
Great. Okay, can you tell me your name and date of birth?
Amy Meyer, April 18th, 1976.
Great. Can you tell me where you are right now?
Nashville, Tennessee.
Great. Can you tell me why you're here today?
For a head-to-toe checkup.
Great. And can you tell me what month it is?
April.
Great. So since the patient also knows her name, she is alert and oriented ×4. So can you tell me, do you have any allergies?
No.
Are you in any pain today?
No.
Okay, great. Can you tell me your height and your weight?
5'2", 135 pounds.
Great. So her BMI is around 25, which is within normal limits. Okay. So looking at the patient, she is sitting upright and erect with good posture. She doesn't appear to be in any discomfort or pain. She's dressed appropriately for this visit, and she appears to have good hygiene. She's speaking normally and appears to be in good mood, and there are no obvious physical deformities. Okay, so Amy, can you stand up and walk to the door right here and back for me? Perfect, thank you. So the patient's walking normally, her gait is balanced, and she isn't limping or in any pain. Okay, so now we are going to assess the head and face. So looking at her head is normosymphatic and round and sitting midline to her body. I'm just going to touch your hair, okay, to examine it a little bit. Great. So looking at the scalp, there is no redness, lesions, or infestations. She has brown hair that is distributed evenly across her head. There's no thinning or balding, and the texture is normal. There's no brittleness. Okay, so can you smile for me? Frown, puff out your cheeks. Great, so the patient's facial features are symmetrical at rest, and they move bilaterally with facial expressions. So now I'm going to assess the eyes. Okay, so looking at the eyes, they are symmetrical. They are in the proper position. You can see it by the papal fissures are lined up with the tops of her ears. She has brown eyes with white sclera and pink conjunctivis. Her eyebrows and eyelashes are present in full, and her eyelashes are going out and curving upwards. Okay, so now I'm going to assess your pupils. So I'm going to ask you to just look straight at me. Great. Perfect. Okay, now just follow this pen line. Great, so the patient's perla is intact. Okay, so now I'm going to assess the ears. So I'm going to ask you, do you wear any hearing aids?
No.
Do you have any exposure to environmental noise?
No.
Great, okay, and so we can tell that the patient does not appear to have any hearing loss because she's been able to answer my questions and follow directions normally. Okay, so now looking at the external ears, they are symmetrical on the sides of her face. There is no redness, inflammation, or swelling, and there's no lesions. She does have one lobe piercing bilaterally. Okay, when I do this, do you feel any pain?
No.
Great, so there's no pain with palpation. So now I'm just going to look inside both of your ears, okay? Great, so the internal ear, there is no swelling, inflammation, or redness. Okay, so now I'm going to assess the nose. So the nose is proportional to other facial features, that is midline to the face and symmetrical. There's no redness, swelling, or lesions except for some macules that are sprinkled across the top of her nose and onto her cheeks. I'm going to ask you, can you plug one nostril and breathe in, now the other one? Great, so she has patency in both her nostrils. Okay, I'm just going to touch your nose. Do you feel any pain with that?
No.
Great, there's no pain with palpation. So now I'm just going to inspect the inner ear. Could you look up to the ceiling for me? Great, there is no redness, inflammation, or swelling in her internal ear or any drainage. Okay, so now I'm going to assess the mouth and throat. So looking at the lips, they are symmetrical, midline to the face, pink and moist without any lesions. Looking at the neck and the trachea, they are both midline to the body. So now can you smile for me and show me your teeth? Great, so her teeth are all present, aligned, and white. Her gums are pink and moist. So now I'm going to look in your mouth, okay? Great, can you stick out your tongue and say ah?
Ah.
Great. So her tongue, her mucosa, her postpharyngeal wall, and her palate are all pink and moist without any lesions. And her tonsils are present, but they are at just a +1, which is normal. And her uvula rises with phonation. Okay, great. So now I'm going to assess the range of motion of your head and neck, okay? So I'm going to ask you to follow a few directions. Can you look to the right, look to the left, look up, look down? Great. Touch your right ear to your right shoulder, left ear, left shoulder, and then just shrug your shoulders for me. Perfect. Okay, so we're just going to do that one more time, but against resistance. So can you look to the right, look to the left? Great. Look up, look down, right ear to right shoulder. Good. Left ear, left shoulder. Okay, now shrug your shoulders. Perfect. So the patient has full range of motion with strength against resistance in her head and neck +5. Okay, so now we are going to assess the upper extremities. So I'm just going to ask you to hold your arms out for me. Okay, so I'm just going to feel your arms. Perfect. So the patient has uniform skin pigmentation throughout. There's no redness or lesions except for a few macules that are scattered across her arms. She has uniform texture throughout, and I'm just going to palpate for temperature real fast. Great, so she has uniform temperature throughout her upper extremities. So now I'm going to look at joints. The patient's joints are symmetrical. There's no swelling, inflammation, or redness. Okay, so now I'm going to look at her fingernails. Her fingernails are hard, round, pink, and clean. She has an angle of about 160 degrees, which is normal. There is no clubbing. Okay, so now I'm going to assess capillary refill. I'm going to just pinch your finger, okay? 1 Mississippi, 2 Mississippi. Great, so her capillary refill is less than 2 seconds. So now I'm going to assess the range of motion of your upper extremity. So once again, I'm just going to ask you to follow a few directions. Can you hold your arms out straight for me? Put them all the way up in the air. All the way up. Great. Now out like an airplane. Perfect. Now can you scratch the top of your back? Pat your lower back. Throw your right arm like you're throwing a softball. Move your left arm like you're throwing a softball. Great. And then can you hold your arm straight out in front of you and bend your, perfect. Just looking at your elbows. Great. Now can you put your arms straight out in front of you and move your wrists up and down? Now side to side. Great. Okay, so now we're going to do some of that again against some resistance. So can you put your arms back out? Push up against my hands. Good. Now pull down. Perfect. Okay, I'm going to put your hands against my hands. Now push towards me. Perfect. Pull back. Great. Now can you put your right arm out and bend it like this? Okay, great. I'm going to ask you to push outwards. That way. Great. Now pull inwards. Perfect. Now the other arm. Push outwards. Pull in. Great, so the patient has full range of motion with strength against resistance in her upper extremities +5. So now I'm going to just palpate her radial pulse. So could you hold your arms out again for me? Great, I'm just going to feel for your pulse here. Great, so her radial pulses are symmetrical, both with regular rate and rhythm and an amplitude of +2. So now I'm going to assess your respiratory system. Okay, so looking at the patient, her anterior and posterior to transverse ratio is 2 to 1. Her costal angle is less than 90 degrees, and she doesn't appear to be breathing with any distress. It seems to be easy for her, and there is no accessory muscle use. Okay, so now I'm going to listen to your breath sounds. So I'm going to listen to 6 breath sounds, anterior, 6 posterior, and 2 laterally. Okay. Just breathe normally for me. Great, I'm just going to go under your shirt, okay? Great. So now I'm going to ask you to turn this way so I can listen to your back, okay? Great. Great. Now just 2 more under here. Perfect. Okay, I'm going to ask you to lift this arm up, and I'm going to lift the shirt to listen to some breath sounds right here. Great, now I'm going to do the other side. Perfect. You can turn back around for me. So I heard clear vesicular breath sounds throughout. So now I'm going to assess the cardiovascular system. So to start that, I'm going to palpate your carotid pulse. Okay, so I'm just going to place my fingers right here. Great, now I'm going to do the other side. Perfect. So the carotid pulses are symmetrical, both with a regular rate and rhythm and amplitude of +2. So now I'm going to listen to heart sounds. So first I'm going to listen using the diaphragm of my stethoscope, using the pneumatic ape to man. Okay, so I'm going to listen to just on your chest. Okay, and I'm going to go under your shirt for this last two. Great, one more. Perfect. So I heard normal heart sounds, S1 and S2 were both present. So now I'm going to listen using the bell of my diaphragm for any heart murmurs, and I'm going to go in the same order as last time using ape to man. Now I'm going to go under your shirt again. Great, so I didn't hear any detectable murmurs. So now I'm going to listen to the apical heart rate. Normally I would listen for a full minute, but for the sake of this video, I'm just going to do it for 30 seconds. Okay, so I'm going to get up under your shirt one last time and listen for 30 seconds right here. So the patient's heart rate is 64 beats per minute with regular rhythm. Okay. So now I'm going to assess the gastrointestinal system. So I'm going to ask you to lay back and lift your shirt up to reveal your abdomen. Great. So first I have to ask you when your last urination was.
About an hour ago.
Okay. And your last bowel movement?
About 4 hours ago.
Great. Okay. So looking at the abdomen, there is uniform skin pigmentation throughout with pink undertones. There are no lesions or redness, and it looks good. So first I'm going to auscultate. So I'm going to auscultate in 3 or 4 spots, starting in the right lower quadrant, moving up to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. So I'm just going to listen to some of the sounds on your stomach, okay?
Okay.
Great, so I heard active bowel sounds through all 4 quadrants. So now I'm going to lightly palpate 3 to 4 times in all 4 quadrants in the same order as before. So I'm just going to touch your abdomen, and I want you to tell me if you feel any pain at any point, okay?
Okay.
Did you feel any pain?
No.
Okay, great. So there were no lumps or masses, and there was no tenderness in the abdomen. Okay, great. So you can put your shirt back down and sit back up for me. Thank you. So the last part of this assessment is going to be the lower extremities. So I'm just going to feel them. Okay. Great. So the skin pigmentation of the lower extremities is uniform throughout. There is no redness or lesions except for a few macules spread out across the lower extremities. Her lower extremities are symmetrical, and the texture is even throughout. I'm just going to palpate for temperature. Great. So The temperature is even throughout except slightly colder in the feet, which is normal. So I'm just going to touch your legs again, okay? Do you feel any pain with any of this? No. Okay, great. So there's no pain with palpation. So now I'm going to assess the range of motion of your lower extremities, okay? So can you put your legs straight out in front of you? Bend your legs. Great. Now can you put them back out in front of you and point your toes towards you? Great. Now point them towards the floor. Perfect. Okay, so we're just going to do that again against resistance. So can you push up against my hands? Good. Now push down. Perfect. Okay, so I'm going to put my hands against your feet. I want you to push down. Great. Pull up. Perfect. So the patient has full range of motion with strength against resistance, +5, in her lower extremities. So now I'm just going to palpate the pulses in your feet, okay? Great. Her dorsalis pedis pulses are symmetrical and have a regular rate and rhythm with an amplitude of +2. So that concludes our assessment. Is there anything else I can do for you today?
No, thank you.
Okay, great. So now that that assessment is over, I'm going to lower the bed to the lowest position, lock it, put up 2 side rails, put the collar in within reach, and then I'm going to perform hand hygiene. Thank you.